Okay, so our topic today, snoring, how to stop snoring. Yeah, these are the sounds that is clearly heard, I guess, every night in some households. So why, so what is snoring? It is also a form of obstructive sleep apnea. This is the underlying issue that most of us tend to overlook, or we do not realize that when someone snores, they have an underlying sleep disorder, which is called obstructive sleep apnea. It's like the iceberg phenomenon. What you see is only 1/5 of the iceberg that is floating above the ocean, and that is the snoring. But it is the 5/6 that is sitting under the ocean, the iceberg that's sitting under the ocean, that can actually have a lot of devastating effects on health. So, what is snoring? It is the vibration of the respiratory structures in the oral cavity of the mouth that happens when air is trying to pass through while we sleep. And it affects nearly 40% of men and 25% of women, including teenagers. And this obstruction is caused by the saggy or floppy structures in our oral cavity and throats. So to illustrate, you can see two diagrams. The upper part is the upper diagram, or is the normal breathing pattern that we have, where it is denoted as blue is where the air moves into the air through our throat. So one is mainly we breathe through the nostrils or the nose at the upper part, as you can see on the arrows here. And second, through the mouth, if some people who have a lot of blocked nose because of deviated nasal septums or sinusitis, even such individuals do breathe through their mouth. But what happens in obstructive sleep apnea is that it is because of the flappy structures. Remember, it is because of the saggy or floppy structures in the throat and the mouth. So one floppy or saggy structure is the soft palate, as you can see here. Here it is not touching the back of the throat or the posterior pharyngeal airway. In the second diagram, you can see it when we lie down and we are asleep, these structures become even more saggy, flappy, and it blocks the airway. Second is the muscles of the tongue also become saggy and floppy, and that forces the tongue also to fall back in our throat. So airway is getting blocked here. When the airway gets blocked, the most natural way that the snorer breathes is like how you see here, they open the mouth. When they open the mouth, the tongue gets pulled forward and the soft palate gets pulled back a little bit. So that is why practically all snorers will always wake up having a dry throat. They feel like they're like choking sensation also can happen. So this is how it looks like in a diagrammatic representation when somebody snores. This is what's happening at the back of the throat. There are floppy, saggy structures in our throat, which is the soft palate, as well as the tongue that falls back and causes the blocked airway, which leads to snoring. So this is how a typical snorer would look like, and this is what the spouse experiences. And this is this is a polite way of saying that even women snore. Okay,
very polite way, yes.
I hope I'm not too obnoxious, but it's a common problem between for everyone. It doesn't only by gender. It's not exclusive by gender. Men and women snore. Even teenagers nowadays, you're beginning to see them having snoring problems, and that is again because of the obesity issue and a short neck issue, which is causing them to have these floppy structures, which is saggy. Okay, to recap, snoring happens when air cannot move freely through your nose and throat when we sleep. This causes the obstructed air movement causes vibration, which produces the familiar snoring sound. Okay, hope everyone easily understands what is snoring. Again, diagrammatic representation. It is this blockage that happens at the posterior part of the throat or the back of the throat, caused by the soft palate and the tongue. This is the root cause of the snoring. So I'm sure many people will ask this question. So what's the big deal? Snoring only what? What we do not realize is many snorers actually are undiagnosed obstructive sleep apnea sufferers. So to me, I always feel that until proven otherwise, every snorer has some form of obstructive sleep apnea. Why this is so important, or why we stress on this issue, is because it is largely undiagnosed. This is a study that was done in 2002, where they have polled, this is by millions, sorry, excuse me, this is by millions, yeah? So 20 million sufferers who have diabetes, 10 million are undiagnosed. Around 18 million people with obstructive sleep apnea, but you only see less than 15% are diagnosed. So this is a diagnosis, this is basically a questionnaire done on snorers. So you can see for 18 million snorers, there's only like less than 15% are diagnosed as having obstructive sleep apnea. So the prevalence, that means the number of diabetics and number of snorers are equal, but the number of diagnosed snorers or snorers diagnosed with obstructive sleep apnea is only about 15%. And this is the ticking time bomb. Why? What do you mean by apnea or sleep apnea? That basically means there is an abnormal pause when we breathe. Initially, when it starts out, everyone has, the pause is for very short microseconds. A very few seconds only you have the pauses. But as the pauses become longer and longer, then the entire system goes into severe shock. Just a moment. So that causes when every pause that the body undergoes, the entire system has to jolt, wake up, and then reset, tell the brain to start breathing again. So every pause causes a devastating effect, and the accumulative devastative effect leads to all these problems. So those with cardiac problems, those who have high blood pressure, stroke, or who have diabetes, we need to keep asking them or keep highlighting the fact that, do you snore? Or we should ask the spouses or partners, does your partner or spouse snore? If they are, the root cause of their diabetes or high blood pressure or heart problems or obesity is the obstructive sleep apnea. And if you treat the obstructive sleep apnea, you are already invariably indirectly treating their heart problems or their high blood pressure and issues or their insulin resistant and diabetic issues as well. So that's how important it is to treat the root cause. So initially, when it was becoming more prevalent that people are suffering from obstructive sleep apnea, these were the initial treatment strategies that were available in the market. Something to see, because you remember the snorers are usually open mouth, so they have like this strap, like the first picture here, to help them to close the mouth. So that makes them breathe through their nostrils. Then you have certain mouth guards that help pull the tongue out as you wear it, as you use guard at night. Then you also have like some devices that you insert into the nostrils as well. to help you to breathe better. But all these were not really giving adequate response or improvement in their sleep apnea symptoms. Then later, they came up with CPAP therapy. This is the therapy that Dr. Lim had given in the interactive question just now. So what does CPAP therapy mean? CPAP stands for continuous positive airway pressure. It is a machine device that the obstructive sleep apnea or snorer wears when they go to sleep. So it encompasses from the nose right down to the mouth. And this machine detects the amount of carbon dioxide being produced. When you do not breathe, the body produces more carbon dioxide. So this device can detect the amount of carbon dioxide that is being produced when we breathe, and it pushes air, positive pressure air into the nostrils, and it helps to push the flappy structures to the bottom and opens up the airway. This is a life-saving device. It has saved the lives of many, many snorers and obstructive sleep apnea sufferers. But it is, when we can talk about it as life-saving, it is really a wonderful product. But the user is the one who is literally in a lot of agony. Why is, once you wear this, like you see, this is the device. It looks very cool, very neat, very futuristic. But when they wear it and sleep, they cannot turn to their sides. And it's very cumbersome because the machine itself is noisy. You'll have a whoosh, clap, whoosh, clap. So even though the person doesn't snore anymore, the spouse still can't get a good night's sleep because the device itself is noisy. And then most users they always say the hose breaks, because when they sleep, they cannot control, are they turning, are they staying stationary. So some devices, you see the hose is downwards, facing downwards. Some devices, the hose is facing upwards. But they have a lot of issues with the leakages or cracks in the hose. This device, you cannot be constantly using for 15, 20 years. The device needs to service, and there are just no easily available service centers. They sell you the device, you use it for 2 to 3 years, then it's time to upgrade a device again. And this kind of devices are costly. It's like 6,000 to 8,000 ringgit for one device. So even though it's a life-saving device, it's quite cumbersome to use. Many negative feedbacks from patients regarding the use. And imagine if you're traveling, if your work requires you to travel, you have to carry this with you wherever you go. And let's say you've gone overseas and the part or the hose cracks. It's not easy to go and source the hoses while you're outstation overseas and it's not available there. So these are a few of the drawbacks of the CPAP device, even though it's still the life-saving device for obstructive sleep apnea sufferers. So now we come to what we provide in D-ERA. It is called the Photona Night Lace. So this is the device. This is the device that we use to treat using the night lace mode or night lace setting, which is a laser setting that helps to treat the problem of obstructive sleep apnea. So why laser therapy? Why not CPAP? Because night lace or the laser therapy, you treat the cause. Even with the CPAP machine, sorry, let me go back. Even with the CPAP machine, you're just increasing the positive air pressure into the airway. You are not treating the saggy, flappy, soft palate nor the tongue. So it is non-surgical. It does not require any surgery. And after you complete the night lace therapy, you do not require to be dependent on any machines or any equipment after that. It really helps to open the airway and helps you to breathe. Those who have been using the CPAP machine, they will require a longer set of treatment, and they might require yearly follow-up to make sure that the tightening effect that we do lasts. That prevents them from using the machine. It is also a very painless procedure. And to do the therapy, you need about 4 to 6 sessions, each session being 2 weeks apart. Then 1 to 2 sessions yearly or twice year or every 2 years to maintain the tightening effect at the back of the throat. And each session lasts only about 30 minutes. So these are the issues again. So when you treat the cause, you treat the obstructive sleep apnea with laser and use the heating and tightening effect, you are reducing the cardiac problems. You are reducing the risk of high blood pressure and stroke. And you're reducing the insulin resistance and diabetes as well, without having to use any medications. Some of them, even with just by treating sleep apnea, their blood pressure normalizes because they get a restful sleep at night. They are not waking up every few seconds just to breathe. So usually, how do we start with when the patient comes in, we do a sleep questionnaire. We inquire about their diet and exercise history as well. We check their throat to see their Malampati scoring. We check their blood pressure and oxygen saturation. We take an intraoral picture of their uvula, the tongue. And we also would always, ideally, we would like them to do a Snore Lab score. Now, Snore Lab is basically an app that you can download from Google Play Store or iPhone, the iTunes Store. We have, DIERA is not affiliated with Snore Lab in any way. There is no profit sharing or anything with that. Why we would like people to download this app and do a sleep score is to just show you, to prove to yourself that there is a clinical difference or marked improvement in the snoring before and after treatment. So this is just a comparative study. Yeah. So how does night lace work? The laser that is shot into the mouth, it heats up the tissues at the back of the throat. By rejuvenating collagen, it tightens the tissue in the mouth and the back of the throat, which is the soft palate as well as the tongue. So thereby it opens up the airway. And once the airway is opened up, the obstruction is reduced, the flappy structures are reduced, and immediately you start seeing the improvement in the snoring and the reduction in episodes of apnea during sleep. You're not going to see an improvement within the same day or within a week. It is only after the second or third treatment. That means every 2 weeks once. So that means after a month to 6 weeks is when a person would begin to appreciate the difference. They will say that they are more alert when they wake up the next morning. They are not exhausted when they wake up the next morning. Or some will even say, I don't need naps through the day, or I don't feel like I'm falling asleep while driving. So it's also important because when somebody suffers from sleep apnea, they can have workplace accidents or even traffic accidents because they fall asleep at the wheel. So that's one of the other devastating effects of obstructive sleep apnea. So this is how the procedure will look. You'll be lying on a chair, on the table. This is the device that gives the laser. That green dot that you see is where the laser is shot. I realize this is not a very clear picture, so we'll just do a diagrammatic representation. So this is the lower teeth, the tongue. So these are the areas that we focus the laser on, area number 1. So that is the side of the pharyngeal wall. And this is the uvula, where the arrow is. Then this is the posterior pharyngeal wall. This is the region demarcating soft palate and the hard palate, and at the base of the tongue as well. Because why you ask them to lift up the tongue, at the same time give the laser under the tongue area to tighten up the tongue muscles as well. So like we said, it helps to heat. When you give heat treatment, it causes tightening and rejuvenation of collagen at these areas. And that is how night lace works, by tightening up all these areas, especially under the tongue and the posterior pharyngeal wall. Yeah. So this is how it will look. This is why we take the shot, the photo of the oral cavity and the uvula. Because once, before you start treatment, you see the narrowed airflow, the obstruction to the airflow and the narrowed airway. After treatment, the airway is now more opened up. So then the airflow is better, and that hereby reduces the snoring effect. So this is the scoring that I was mentioning about earlier. So this is from one of our patients, our clients. We were not able to do the 1 week's snore score prior to treatment. So his first treatment was on 18th of January this year. These are all this year's results here. So you can see the snore, it was 21. This is how it calculates. It shows what time you went to sleep, what time you woke up, how many hours of sleep you had. So you see from 2 to 7, it's more than 5 hours, but it shows that you only slept for 4 hours and you were snoring for 1 hour, 13 minutes. And these are the spikes are all the snores. So light to loud. So when you're snoring loudly, your airway is blocked. You're not breathing well. So even though you had 5 hours sleep, actual sleep was only 4 hours. So the gentleman had the treatment, and then this is when he came back for his one visit. You can see that the score had not improved. In fact, it became worse. From 21, it was 29. He was sharing his scoring throughout after the treatment. Then second treatment was on 7th of February. After that, 3 days after that, you begin to see the snoring score is less, even though the amount of time awake was more than an hour, but it is not the loud type of snoring. So you're having shorter gaps of apnea. This is 9 to 10 days after that. You can see the score has dramatically reduced. And most importantly, you see the snore time has reduced to minutes, no more in hours. This is like 75 minutes over here. It's now 9 minutes over here. This was already before the third treatment was on 28th of February. But even before the treatment, he is having good restful sleep. His snores is less than a minute. This is the most latest that we've got. His score is still maintaining, even though his last treatment was on 28th of February. This is April 14. You can see he slept from midnight to 7:16 in the morning. He's had a restful sleep for the entire 7 hours and 16 minutes. There is no minutes of snoring. His snore score is 0. And I'm sure his mental faculty is now much more improved. Concentration will be better. Energy levels will be better. And once you have such good restful sleep every night, you will certainly have so many cascade effects, knock-on positive effects to your entire system. So your blood pressure readings will be lower, your insulin resistance can reduce, you will have more endurance and stamina when you exercise. The oxygen concentration levels, oxygen saturation levels will be increased. So with one treatment, you're actually covering 3 to 4 different systems altogether. Yeah. So we're coming to the end already actually now. So basically this is the take-home message. Night lace is a well-tolerated procedure, has minimal treatment complications. The usual feedback we get from clients is that they feel like the area where they have done the laser, they feel it's the mucosa or the area feels more dry. So they just have like a dry throat symptoms for a day or two, which subsides after that. Some develop some dry cough for the first day or two as well, which immediately subsides thereafter. So it is hardly invasive. I consider it invasive because the probe is going into your mouth. Other than that, there is no invasive, there is no cut or opening up of any tissues. And there is a significant decrease in dry mouth sensation on waking up. Patients are quite satisfied with the results because, as you can see, the snore scores are going down. So this is a very simple, very effective, long-lasting treatment for obstructive sleep apnea and snoring. So those who are just snoring, who are not on any CPAP devices, this will be an ideal intervention to prevent having to require using CPAP and deterioration in the general health and well-being. So that is about all we have. And if you would like to know more, you would like to discuss with us more, please feel free to connect with us on the Heart Voice. This is our new app that we are launching from Clinic Diera. You can contact any one of us. You can have further detailed discussions on it. All you need to do is go to this website, which is called www.ourheartvoice.com/Diera Clinic. You can connect, download the app, and connect and discuss with us, and we will be more than free to give you an online consultation if you need to know further, not only about night-lace treatment, but any skin issues, aesthetic treatments, functional medicine, hormone balancing, and all the other services that are provided by Clinic Diera. Thank you very much. So I know there will be a lot of questions. I would just request everyone to just hold on with the questions for a few minutes because I've got some exciting development I would like to share. We have one of our patients who is very gracious enough to reveal his identity and also tell you what are the improvements he feels after going through the night-lace treatment. So it gives me a real privilege to introduce to you Mr. Jun Wong.
Hello.
Hi, Mr. Jun.
Yes.
Thank you very much for joining us.
Yeah.
Thank you for giving the permission to share your snore lab scores as well. So the floor is yours. Please share with us your experience and testimony. Thank you very much.
Snoring to most people is like something not that important when they are on their own. But once they are staying with somebody, then your snoring may disturb the other party. So I decided to go for this snoring treatment because all along I didn't know that I snore until I have complaints that my snoring is disturbing other people's sleep. So even when I travel, sometimes I share a room with friends and I notice my friend is snoring just as bad and his snoring is also disturbing me. So when I heard about night lace, I decided to give it a shot because it's number one, it's painless. There is almost zero downtime. It takes about 10 minutes and it's very, very affordable. After my first treatment, in fact, I didn't have this Snorlax score. After my first treatment, I was measuring my score and I was quite surprised it was still bad. Sometimes the score can be in the 20 range, sometimes it can go up to 60, which is the epic snoring. But I perceive after 2 weeks, I go for my second treatment. When I did my second treatment, I realized that the score has come down tremendously. And I'm coming into the single digit range now. Usually my scoring is in the double digit range. So for the first time, I get single digit, meaning score of 8, 9, 7 kind of score. And the night lace treatment requires you to go for about 4 treatments to see results. I am already seeing results in the second treatment. When I did my third treatment, which is about another 2 to 3 weeks later, I in fact is getting score of 1 and 0, which was very, very surprising. This is the month of June. This is the month of May now. Since my last treatment, it was about 4 months ago. I have very good sleep. I do not have complaints from my partner. and my score is still in the 0 range. So I would definitely recommend this treatment to anyone who have this snoring problem, because for the amount of money that you are going to spend, which is 700 ringgit per treatment, I think the quality of sleep that you are getting, and also the quality of relationship with your spouse and your partner, you cannot measure that, you know, just based on the treatment itself. It is the quality and the better sleep that you are getting, and you make everybody happy. Thank you.